Hello, good afternoon. Sorry for the slight delay. Welcome to the sixth and final session of the live chat with Yusrin. As usual, we'll be discussing about eczema-related topic. For the final session, we'll be discussing about how to psychologically and physically confront eczema in you. First of all, as per usual, there is some messages I would like to remind the audiences that are tuning in. My name is Dr. Vincent Ng. Today we got held up a bit because I was finishing up with a bit of patient. I'm so sorry for that. You can PM us questions after my talk. You can write in messages or through Facebook or whatever means that you can. And then you can you will be receiving a free gift from Yusrin. If your questions is managed to be posted, you'll be receiving a tube of Eucerin soothing cream that is worth 65 ringgit. Okay, and I'll try my best to answer all the questions that you post in. Okay. So without further ado, we'll start our topic of discussion today: how to psychologically and physically confront eczema in yourself. This is actually quite a huge topic. I'll break it down to a couple of sessions. I'll try to go slow, but it'll be quite impossible for myself to answer every question related to this topic. Okay, first and foremost, I would like to mention this point. Eczema is hereditary and occurs in young age. If you've been tuning in over the last 5 sessions, you already know. Atopic eczema is actually an inflammatory illness of the skin that has got certain relation with the immune system of the body. Eczema is very, very common in children. About 1 in every 5 children in Malaysia is estimated to have some form of atopic eczema. It is genetically linked. It's a genetically linked illness, meaning, let's say if you have your parents or your grandparents that have eczema, the tendency for you to get eczema is higher. It's not only genetically linked to eczema, it's also linked to a group of illness that we call a group of illness that shares the common immune modulations, for example, like the allergic rhinitis, allergic conjunctivitis, and also asthma. Patients with genetically inclined predisposition to get eczema or the other few illnesses will have to be very careful in their life, because this gene will interact with the environment, and throughout this interaction with the environment, it will decide how well the illness, how well the child do, or how badly the illness becomes. So again, to simplify, eczema is a genetically linked condition, and it has a very strong environmental influence to the condition. As I've also mentioned, eczema usually presents very young in childhood. Usually they typically present with itchy rash that appears before 5 years of age. However, I would like to stress here as well that not every itchy rash in a child is atopic eczema. Hence, first and foremost, it is important for the parents or the caretaker of the child to seek proper medical advice and get a proper diagnosis before you go around label your child as having atopic eczema, right? That is the first key point that we've discussed. Coming down to the next key point that I would like to discuss and elaborate will be patients and parents should learn to accept eczema as a lifelong condition and know how to take care of themselves emotionally. Okay, since eczema is a genetically linked illness, we know that genes in that person cannot be changed. The gene will remain same. The genome of that human being, but in particular, will remain same throughout its lifetime. It is how we can control this illness from presenting itself or reducing the exacerbation of eczema. So you have to remember that eczema is indeed a lifelong condition. Okay, the symptoms, like we have discussed last few topics as well, for atopic eczema is patients get a lot of rash and itch. If you examine the patient's skin closely, you will see a lot of red marks, red patches, which it coincides with the rash. You will also feel the patient's skin to be hoarse and dry, in the sense that because in patients with eczema, they lack certain element to retain water and makes their skin drier. And when the skin is dry, it actually makes the skin less healthy and more prone to get exacerbation. Hence, it is very handy with companies like Eucerin and a few others that come up with creams like this that can help address the dryness of the skin of a patient in eczema. Dry skin, as I mentioned earlier, throughout their life will interact with the environment in the patient's and living environment. They are more prone to, more vulnerable to irritants and also to allergens of the environment. What are the irritants that are common? We'll discuss a bit more later. It'll be like things like a perfume, cosmeceuticals. Allergens can be pollens, can be bed bugs and things like that. Because of their genetically dry skin, they are more prone to get irritation from these environmental factors and hence triggering a exacerbation of the eczema. And like I've mentioned, itchy skin is the most common symptom in eczema, and itchiness is actually a form of severe form of irritation. And since we're discussing that itchiness, we were discussing a bit about how patients and parents should learn how to take care of themselves emotionally, because when a patient feels itchy, it is actually a very stressful form of sign for a patient. In fact, it can be as bad as feeling pain. Constant itchiness actually can break the patient emotionally. Hence, I would like to stress here that a very supportive environment is important to help patients cope during the exacerbation when they feel the itch itself, no matter what age the patient is. Always remember that this condition will follow the patient for life, so they have to be facing this symptom of itch on and off. So building up a good mentality, a strong mentality from young to face the illness, to confront this symptom is actually very important. This is where I would say, let's say for a young child, this is where the family plays a very important role. Usually, I always encourage my patients' parents to be actively involved, with my management, to discuss with myself what is the pro and con, how they can help patient cope, and how they can support patient emotionally. I always tell them, do not disregard the symptoms of itch as saying that it's nothing, compared to pain or anything. It is actually very, very stressful. We've come a long way from those days whereby the doctors just prescribe certain medication and let the patient go home and apply the medication, and that's it. We have actually learned more about illness over time. Even we doctors have evolved to provide even more comprehensive cover for the illness, and we noted that psychological stress is actually a very, very important part that a patient face in eczema. Also closely linked to this point is my third point, that eczema can physically affect a patient's appearance and also social ability. Not only the patients feel emotionally distressed by the symptoms itself, the itch and all, the presentation of rash and redness, right, over their skin, more so if the rash is over their face, right, where patient can see every day, or maybe in their hands when they communicate with patient. This actually can cause even more mental stress for the patient. Studies have shown that there is very, very significant stress factor associated with patients having rash on their face. Hence, from where I was taught in the University of Cardiff, they've actually developed a score to help medical doctors detect the degree of stress, degree of psychological stress that a patient is under from the illness itself. So now we, as doctors, we have to treat the symptoms, signs, treat the illness itself, the eczema, to try and control it, And also we have actually evolved to address the psychological strain that comes along with this illness. Uh, as we know, psychological strain and all can impair patients' confidence, especially at a young age, when they or in early adolescence, when they start to interact with the society, when they go to college, when they start making friends and start communicate, they can feel shy, they can feel upset about their appearance. It will affect their self-confidence, and this is actually a vicious cycle. If it's not attended to, if patient is not treated for the illness itself, and also not helped on the psychological stress itself, it can actually be a vicious cycle where patients become more and more introvert and reduces their ability to present themselves to the world and also to achieve whatever they can set out to do in the first place. So in growing children and young adolescents, I would like to stress that psychological stress from eczema can have a very negative imprint in their life. This can change the very foundation of patient's character and influence his whole life ahead. Hence, I would again stress to doctors and also parents not to take the psychological stress from eczema lightly, right? See a doctor. If you find that you need any help, you discuss with the doctor. They can score your child, and we can take it from there. What is the best way you can help the child cope with eczema? Certain few things, okay, that can be done is usually we advise parents to be patient, to be supportive. There's no hard and fast cure to eczema. We need have topical creams available, we have oral medications available, but most of them take time. And it's during this time where the medications start to take effect, parents have to be very supportive and very patient themselves to not stress out the kid further, right? Point number 3 that we'll discuss here will be fighting eczema is a long-term battle. Patients should prepare themselves that even when the eczema has subsided, it can recur. Okay, we know that there is no permanent cure for eczema. What we medical doctors hope to do is to induce a resolution of the illness and maintain them and to suppress the illness. One of the key things that we need to help suppress exacerbation is a very, very good moisturizer here. I'll go into that a little bit more later. If there's any bout of exacerbation triggered by anything at all, please seek a doctor and control it fast, right? Simple things that you can do to help your kid, or maybe the kid or the patient can help themselves will be in terms of clothing, because it's a long-term battle, it's a lifelong condition. So maybe you can start by choosing the right form of clothing. Loose clothing generally do better. Very warm and irritating clothing made from wool can make the eczema worse, can exacerbate the skin. I'm sure those that have eczema their whole life, they've actually learned how to adapt to which type of clothes that actually make the skin feel comfortable, right? Cosmetics in ladies, another very common triggers in eczema. It can be a bit tricky. Not all cosmetics can trigger eczema, but a lot of them that come with preservatives and also fragrance can be a key trigger factor in eczema. My advice is, if you really need to try out a cosmetic, go ahead, try it. If it triggers a bout of eczema, avoid it totally again. Never ever try it again. And then until you find some form of suitable cosmetic to your skin, right? And for kids as well, certain things that you can do to help kids adapt is, because we know that itch is a very significant symptom in eczema. Prolonged scratching of the skin can damage the skin. It can cause secondary skin abrasion and then leading to bacterial infection. So simple things that can be done includes parents can advise the children to keep short fingernails. Even adults themselves can keep short fingernails, so that when they scratch, they do not actually damage the skin so much. In very, very severe case of itch, consult a doctor. Certain wraps can be prescribed to prevent scratching during the day or even at night, right? Last week, we've also discussed about traveling. Since a lifelong condition, we've also discussed a bit about traveling. I hope you've learned a few tips from traveling, because in the world we live in today, we travel a lot as well, for business, for leisure. So know what to do and what not to do before you travel. Check out the local temperature, because temperature change is a key trigger to eczema. Know the local temperature, prepare adequately, and always bring a good moisturizer with you wherever you go. Bring topical medications just in case of exacerbation. Talk to a doctor before you travel. That's a very, very good tip, right? And also, if let's say one of the main factors that parents, if they were to look at to help their young kids, because kids, they do not know much, as they grow, they will learn more, is to the caregivers or parents can learn how to identify certain trigger factors that are more that triggers the illness in that particular child. So by avoiding these trigger factors, it actually helps the kids cope better, and also less exacerbation. Examples of trigger factors I've already mentioned earlier. Something perfumes, detergents, very, very harsh soaps as well. Extremes of the temperature, very, very hot or very, very cold, or sudden change in temperature can also cause exacerbation of eczema. And of course, I've also mentioned earlier that eczema actually causes a psychological stress to the patient. By supporting the patient, reducing the stress, you'll be surprised that the illness itself becomes more easily controlled. So help the patient cope, support the patient properly. Do not stress out the patient more. So these are the few key factors that I've discussed earlier. Let me just do a quick recap before I finish up with my final point. Today we discussed a bit about how to psychologically and physically confront eczema in you. First is eczema is hereditary. It interacts with the environment and occurs from a very young age. Patients and parents should learn how to accept eczema as a lifelong condition and know how to take care of themselves or their child psychologically and emotionally, because it can affect one's appearance and hence impairs the person's social ability. Next point, fighting eczema is a long-term battle. Patients or caretakers should prepare themselves to face the condition, even when it subsides, because it can recur. Identify the trigger factors, prevent the common irritants, support your skin with proper skin care, proper moisturizer, which leads us to my very important last point. Right? What are the steps to improve skin conditions and quality of life in a patient with atopic eczema? So quality of life is very, very subjective, actually. I mentioned earlier, itch is one of the most important irritating symptoms one can face. Hence, to improve quality of life, we need to reduce itch. Itch can be controlled by oral medication during exacerbation. Do not hesitate to see a doctor. Get the proper necessary prescription if you need. It will help reduce this irritation. It will improve your quality of life. And how to improve skin condition? I've mentioned so many factors earlier. Example, proper clothing, right? Proper cosmetics if you need, proper soap. But I've left out one very, very important point until now. I want to stress out, because I wanted to stress this out in the end. If your child's skin is kept clean and moist, eczema symptoms are less likely to occur. Again, if your child's skin is kept clean and moist, eczema symptoms or exacerbations are less likely to occur. How can you do that? Sounds very simple. Yes, indeed, actually it is very simple. First is a proper soap. Actually, we do not want soap. We want a soap-free cleanser that will not irritate the skin. That is very, very mild to patient's skin. You can try use rinse cleanser or any form of bath oil that doesn't that dries the skin further. That is one. Just light cleansing will do. Light cleansing as in no hard scrubbing on the skin when you shower. Just apply the cleanser or bath oil on it and just wash it off. That will keep your skin clean enough. And come the point how to keep your skin moist. Moisturizers that are suitable for eczema skin is important. You need to choose one that is clinically tested, medically proven. We have a lot in the market, and of course one of them that I have it here will be the cream that you'll be getting free if you manage to post your question in. It's worth 65 ringgit. Moisturizers that are suitable for eczema prone skin again are usually unscented, devoid of common irritant. And it is also important that when you get a moisturizer, you must get a moisturizer that you like or the child like as well. If not, the child will not be applying. Because for myself, a moisturizer to an eczema patient is actually a lifelong friend. They have to go hand in hand. They cannot live without one another. So identify one that is good, persist with it, use it regularly. It not only will help on reducing your eczema. Actually, a good moisturizer like such, it can actually reduce the skin aging, which I also see a lot of patients in nowadays to try and reduce aging. It's actually a good moisturizer, keeps the skin healthy, keep it moist. It actually helps reduce aging as well. So again, simple things that you can do to help yourself or your kid is to always keep your skin clean and moist. How to keep your skin clean? Get a proper soap-free cleanser or bath oil and a suitable moisturizer for yourself, because as a final point, I like to stress out again, a suitable moisturizer like such is an eczema's lifelong friend, right? With that, I conclude my talk for today. I'll be taking some questions. I hope I can answer as many as time allows me, and I hope I can answer them clearly as well, right? Okay, the first question is from Karen, right? Oh, the first question is posted by someone without a name. My job requires me to apply makeup. Should I apply any protective layer before makeup? Okay. So your job requires you to apply makeup. Okay, not all makeups are triggers for eczema. First, you need to identify the proper makeup that does not exacerbate your eczema. Stick to that one. Do not go become fancy and try new ones as they come along. But if you really indeed do want to try, you can. But if it triggers eczema, then please stop using it. The next part of the question mentioned was, should I apply any protective layer before makeup? I've also just said earlier that moisturizer should be your lifelong friend. Yes, you can apply a layer of moisturizer on your skin, leave it to dry for about 10 minutes before you applying your makeup. It actually helps. It's actually a very good long-term practice. Not only on the face before you apply makeup, you can apply it all over your body on the skins that are needed, right? Before you go out, once in the morning before you go to work, and once at night when you come back before you go to sleep. And of course, again, since moisturizer is needed lifelong, it is important you identify one that you like, one that that you can use long term, right? I hope that answers your question. The next question here is, I have eczema and I tend to sweat a lot. It causes redness easily. What should I do? This question is posted by Ben, by the way. Okay. In Malaysia, everybody tends to sweat because we live in a very hot and humid country. Okay, apart from recently with all the rains and all, but in general, we tend to sweat a lot, and sweat under certain conditions is actually an irritant to the skin. But of course, we'll not go into that topic. If you can, always try and keep your skin dry. If let's say after sweat, try and clean off fast if you're able to. If not, it's okay. It causes redness easily. What should I do? Like I say, sometimes the redness after sweating is actually from the perspiration itself. It may not be related to the eczema illness. If it is just some form of slight redness and sweating but no irritation, I would advise you that you do not need to do anything. But should the redness, let's say, should the redness becomes itchy or it become raised, then you have something that is called some form of skin allergic that caused by the irritation of the sweat. That you may need some oral medications to subside it. Or most of the time, some patients that do have this, it's actually called urticaria. Most of the time, some patients that do have it, they actually learn how to cope. That means they learn how to take certain preventive medications before going for sports. But for this, I think it is best for you to consult a doctor. Let the doctor see the redness of the skin or the rash that you have after exercise. Right? Next question is from Chan. Cream or lotion, which one is more effective? Actually, it is not the cream or the lotion that makes certain product more or less effective. It is actually the ingredient that is used, the medical ingredient that is tested, that is in the product per se. Cream is actually used just to how do you say? Cream is actually a base for the manufacturers usually to put any form of chemical products inside, medication in it, and to mix it up in the cream so that it can be presented to a patient to apply. Same thing with lotion. So again, cream or lotion, it really depends on the ingredients in the particular formula to decide the effectiveness. Like let's say if you have Eucerin, it's a cream. So the active ingredient here will be the 12% omega and lycocalcone A. It has been clinically tested. So whether if this is presented in the form of a cream or lotion, with this ingredient, it should help the patient's skin per se. But in general, for cream, it can help occlude. I mean, it causes a certain kind of occlusive and retentive moisturizing effect as well versus a lotion. Again, look at the ingredients of the product you buy. Cream can help retain a bit more moisture sometimes, but the ingredients of it, it's the most important part, right? I hope that answers your question, Chan. The next question comes from Amy. Should I avoid any food if I suspect I have eczema? Well, first of all, I'd like to address the part if I suspect I have eczema. Like I've mentioned earlier, always see a doctor, get a proper diagnosis. Do not self-label. Do not self-label yourself as eczema or having any other conditions. Get a proper medical advice. See if it's eczema, what form of eczema it is. There are a few types of eczema. Yes, there are a few types of eczema if you've not known. Just see a doctor, confirm if it is eczema, right? Okay, then you mentioned, should I avoid any food if you have eczema? Okay, we mentioned that patients with eczema, they are known to have let me rephrase. Patients with eczema faces a lot of trigger factors that can actually exacerbate the illness. If you have eczema and one of your trigger factors are food related, yes, then you have to pay particular attention to the type of food that you are taking. From personal experience, what are the common food that triggers eczema? Seafood, shellfishes, peanuts. Those are the very, very common ones. Eggs, chickens are also common. But without saying that everybody, I don't want to stress until everybody avoids all this food. Just pay attention. Different patients are very different to the susceptibility of different types of food. But if let's say every time, if let's say you face a scenario whereby every time you take certain food, and then the eczema or there is a kind of rash or itchiness on your skin, it may not be eczema related. It may be allergic reaction. That also you need to address with the doctor. Okay, let's say if a patient with eczema and they have been getting exacerbation and they think it's triggered by food or by certain allergens, but they are not sure, how can we then go about identifying it? We can actually do certain tests, immunology tests that is carried out in local labs nowadays. We can withdraw blood from the patient. We test for the antibodies to certain type of food or to certain type of trigger factors, not only food, food and house dust and house mites and certain chemicals. You can inquire about it with a doctor. I'm sure they will advise you further. These are simple tests that you can go about and confirming what you are allergic to or what you are not allergic to, right? From Penny, my friend has allergic to most food, especially meat, regardless of white or red meat, corn flour, and so on. Is it possible for her to have eczema in future because lack of some nutrients? Okay, we'll go through a few part by part of this question. My friend have allergic to most food, especially red meat, regardless of red meat or white meat, corn flour, and so on. So it seems to me that your friend has what do you say, very severe allergic reactions to this type of particular food. My advice is to avoid this kind of food. Every time that your friend get exposed to it or consume it, they will inevitably develop some kind of rash and allergic rash and itchiness. That is actually not very scary, but some patients, if they're exposed to very high dose of potential triggers, can develop certain shortness of breath and also sort of like a difficulty breathing that can be potentially dangerous. So I would advise your friend to avoid all food that he or she finds to be triggering such events. The next part of her question is it possible for her to have eczema in the future because of lack of some nutrients? We have not concluded to, we have not actually medically proven that eczema lacks certain orally consumed nutrients, but there's a study that believes that certain nutrients, more of the antioxidant categories actually help improve eczema exacerbations. But again, evidence are not strong. I will not go into that. But you wanted to know, is it because the patients lack certain nutrients? Most of the time, that is not true. But what happens is in the patient's eczema skin, right? Patient's skin, an eczema patient's skin lacks certain kind of proteins, right? They are born without this protein, and hence the skin are a bit drier and less healthy, which makes it more vulnerable to environmental factors to trigger eczema in it. That is why we need to replenish the moisture in patient's skin, because they are genetically born with a slightly drier skin than normal. This is proven. This has got nothing to do with nutrients consumed. They are usually born with it. And how can you help such patient? Again, like I've mentioned earlier, a lifelong moisturizer, a moisturizer like this, right? This can serve as what we call a nutrient to the patient's skin and help the illness. So I hope I've answered this part of your question as well, Penny. Right. Next question is posted by Father Esther Lee. Do you encourage vitamin E lotion for eczema? As some said, it might not be better than normal lotion. Again, there are a lot of moisturizers available in the market. Esther, like I said, there are a lot of moisturizers available in the market. It is down to consumers, most of the time it's down to consumers' intelligence to seek out the best product available there. There are many manufacturers that comes out with very good topical moisturizer that is clinically tested to help eczema prone skin. One of them, again, I've been showing this a few times, is Eucerin's soothing lotion. There are also a few brands. You can check out the doctor or pharmacist. As long as it's clinically proven, it will help your skin. And you said here that you wanted to know about vitamin E lotion for eczema. I've seen a lot of vitamin E available in the market. Some manufactured, I think the quality may not be there because of their quality control, and there's also no clinical evidence. So in such products that claims have vitamin E, they may actually not have vitamin E. So sometimes it's hard for me to answer your next part of the question, because they say it may not be better than a normal lotion. A lot of this, like I said, it has got to do with the quality of the product, the clinical control, the clinical study of the product. If you have a really strong clinically studied and quality controlled vitamin E lotion, yes, it can help eczema. But again, like I say, you have to use what we call consumer intelligence to seek out the best available clinically tested product in the market. Do not easily be persuaded to purchase something that is easily available off the counter or from any beauty centers, right? I hope you get the message. Next question from Guide Kim. I used to develop eczema around the areas of my mouth after consuming seafood. Now the area is dry and has dark discoloration. How do I get rid of it? Okay, I'm assuming that Kim, you have eczema. You have been diagnosed with eczema, right? Okay. If you do not have eczema, it may not be eczema. It may be just contact dermatitis. That means it's just an allergic form of eczema, allergic kind of skin reaction. And let's say if you find that seafood it's a triggering factor, do avoid it, right? Any form of rash, if it's treated properly, will resolve and the skin should go back to normal, right? Meaning it should not feel dry anymore. You mentioned here that this area is dry and has dark discoloration. Most of the time, this dark discoloration comes from inflammatory pigmentation. That means the inflammation of the area has caused some pigmentation to be deposited around there. And the dryness can be caused also by the irritation or the underlying skin condition that is still active. Hence, I would advise you to seek a medical doctor's advice, have a look at the area, control the exacerbation of that rash. Then, over time, once it has resolved, the skin color should come back to normal. Okay, because of what I do, I may be able to answer further to the part of the pigmentation. Only if after controlling the illness or the patch of the rash, and we give it about 3-4 months, and the rash and the dark spots doesn't disappear, we can actually proceed to some form of laser treatment to get rid of the pigmentation. But first and foremost, you need to control the underlying illness. Let it cure it first, leave it a while, the pigment should go away. If it doesn't, you can come see a doctor and discuss with the doctor how to get rid of the pigmentation, right? Next question is from Kitty N. Hi, Dr. Vincent. I have dry, itchy thighs that gets reddish when it's hot and humid. Please advise. Thank you. Yes, I have also a similar question posted earlier, that the skin becomes a bit red after the patient sweat. I say it can be a normal reaction to perspiration. A lot of times, nothing needs to be done. Probably avoid tight clothing. Let's say avoid tight jeans. That can help. If the redness persists even after the sweat has gone away and develop a rash, and the skin remains itchy for the next few days, then you may have some form of local local contact dermatitis or irritant dermatitis that is caused by a sweat. Then you need some topical medications. It can range for a mild potency topical corticosteroids to a high potency one, depending on the severity of the illness, or also depending on severity of the itchiness. Oral antihistamines can be indicated if necessary. So have a look at the rash again, redness again. If it's just normal redness that disappears after the skin dries up, usually just leave it alone. But if it leaves such a legacy effect over the next few days of whereby you get itch and all, then probably you need to do something more. You can get a doctor's advice and see what can be done, right? The next question is from Chia Tek Singh. I develop itchiness over my body if I consume seafood, such as crab. So here you've managed to identify one of the seafood that triggers the rash. So first and foremost, avoid taking crab. But of course, you can try other seafood. Not all patients are allergic to so many seafoods. You can try it. The next part of the question is: will taking antihistamine like Zyrtex help? Yes, all form of antihistamine can help. Certain antihistamines are proven to be better and longer lasting than others. There are a lot of antihistamines outside. Of course, antihistamines are very easily available nowadays. Um, Even though it's actually a control item, pharmacies should not be selling it over the counter. But we know that sometimes it is quite easily available, and a lot of patients actually buy them off and start taking by themselves, thinking that antihistamine is very safe. But actually, antihistamine has its own side effect. But we very seldom encounter them. So before taking any histamine, I would advise you to seek medical advice and see what is suitable for yourself, right? And should you think you need further study on what type of food you're allergic to, you can take a panel of the immunology test with local labs or see a doctor. They can come up with quite a good summary, quite comprehensive summary to guide you on food that you're allergic to or those that you're not allergic to. Right? I hope that answers your question. Right? That's all. Right? Okay, so we have come to we've answered all the questions, and this is the final session. I would like to thank everybody for tuning in. I hope I've managed to clear out some doubts that you have on eczema and help you cope with your illness better over the last 6 sessions. Of course, I'd like to thank Yusrin for giving me this opportunity to hold this live chat. And I think Yusrin, they do put a lot of effort into trying to help patients with eczema cope better in their life, and hence they put a lot of effort into their research to come up with quality, clinically tested products for eczema skin. Don't look out for them. You can go to their Facebook, or you can test out their products, right? And thank you again for tuning in. You can still PM the questions to us. You will still be receiving a free gift of soothing cream, one tube that is worth 65 ringgit from Eucerin. I hope I'll be seeing you again. My name is Dr. Vincent. I'm from Lifestyle Aesthetic Clinic in Bangsa South. You can feel free to drop by and see me too if anything at all. Thanks. Bye.